Hi there, this is Prague Talk, a podcast from Radio Prague International. My name is Ian Willoughby. My guest in this episode is Dr. Tomáš Páleníček, a leading Czech proponent of the use of psychedelics in certain kinds of psychiatric treatment. I came across him recently in the documentary Doctor on a Trip, directed by David Čálek, which follows the psychiatrist and several colleagues to the Amazon rainforest, where they map brain activity during ceremonies centered on ayahuasca, the traditional hallucinogenic drink. And I discuss several aspects of using mind-altering substances in psychiatry with Tomáš Páleníček for this edition of Prague Talk. The main reason that I wanted to speak to you was recently I saw you in a relatively new Czech documentary, Doctor on a Trip, that partly shows you and your team going to the Amazon rainforest and conducting tests with ayahuasca. What exactly were you researching there?
Well, exactly when we went there, this was still a pilot measurement. So the idea is to evaluate the effects of ayahuasca on brain activity and brain synchrony and inter-brain synchrony in between more people, and also to evaluate the long-term effects on mood and well-being of people who go through the experience with ayahuasca in the traditional ritual. So what we see in the movie is kind of a pilot testing of whether we are able to collect this kind of data. And all the people who were volunteering were actually part of the team, of the research team. And what we did several travels. And on one travel, we've tested the equipment, whether it will work. Actually, we had two equipments, and one of them failed because of overheating. And during the second run, we imported 7 amplifiers, EEG amplifiers, and we've tested synchronous recording during the ceremony. And even though we didn't expect to collect some meaningful data, it was mainly to adjust like how to record, how to synchronize, how to adjust video and synchronize it with the camera, how to adjust audio and synchronize it with the EEG. So this is quite a complex task. And luckily, when we were there last time, we had 2 occasions when we were able to record low dose and ayahuasca ceremony with low dose and ayahuasca ceremony with higher dose in the same volunteers. And we found out that we are able to collect the data synchronously from all participants that were wearing the EEG cap and were connected to the amplifier.
And you found the participants were synchronized, their brains were synchronized during the ritual, but why was that important, or why is that important?
One of the things that we are looking at in psychiatry and in psychotherapy is the effect of group therapy. And within psychiatry and psychotherapy, group therapy is just normal therapeutic tool that is used. And current psychedelic studies typically involve participant, patient, and sitters or therapists that are accompanying him throughout the experience. But in the traditional context, in the ritual context, it's typical that there's more people present, and they go through the ceremony or through the altered states of consciousness together. And when we look on how these two things relate to the, let's say, Westerner approach, so one-to-one treatment approach is very, very expensive, because the time the therapist spends with the patient is really extended. When we go to kind of a group therapy setting, it might be more cost effective, and also it might have its own dynamics, which might be very different to what we observe one-to-one. So what we are looking at is to understand the dynamics of the group process, and to see also how the effects that are present, or the stimuli that are present in the environment, how they are related to the potential synchrony between subjects. We know, and most people obviously who have the experience with psychedelics, they might say, yeah, that we feel the connectedness to other people and so on. But this is something we would like to measure, and actually it seems we can measure it with the EEG. And the question is, what makes the connection? Is it the substance? Is it the ritual? Is it the shaman? Is it the song or the music that is presented? So these are variables that we would like to control for, and maybe in the future apply this to group therapy sessions, and also to have a look whether any of these parameters can be related to the long-term outcome, or more, to be more connected to the long-term outcome on mood and well-being.
Also in the film, we see your own father, who seems at least a little bit skeptical about your findings or about this whole area. Is he a psychiatrist too?
No, not at all. He's actually, he was a sound technician working on Czech TV. Now he's retired. He will turn 80 this year. And he doesn't like much about these psychoactive substances at all. So from completely different area.
And what led you to psychiatry, and specifically this area of psychiatry?
Hard to say. I have a hypothesis why I was attracted by these altered states and by these compounds. But actually I realized during my studies on high school that I was interested in biochemistry and organic chemistry, and was interested in alkaloids, and studying the effects and looking on internet what they do. Well, was there internet on that time? No, that was mainly in books. Internet was later. But anyway, studying what they do and how it's possible that they alter our cognitive functions and perception and so on. And then I was accepted to study medicine. I studied medicine. And then again, as a coincidence, in the 5th grade, I got in touch with my former supervisor and one of my best friends in these days, Professor Jiří Horáček, who is also in the movie, and he offered me PhD studies on animal models of psychosis. And at that time, I wasn't sure if I want to go directly to the clinical practice, and he said, well, you can study what you like to study. These are like animal models of psychosis are typically modeled by psychoactive compounds. We use ketamine typically, but the others like LSD and so on, they also are used in this context. So okay, let's give it a try. And I started to do my PhD in preclinical science. And on the 2nd year of my PhD, I wrote a project proposal that was accepted by the grant agency, and this project proposal was already focusing on LSD, psilocybin, mescaline, MDMA, and all these compounds in animal models, and that's where it started. So that's how I get to it. And maybe the complete beginning is my hypothesis. When I was a child, 3 years of age, I was heavily burned by hot tea, and I was for 3 months inpatient in a hospital, having plastic surgeries and all of that. And what we know in kids who are burned, they are nearly continuously on the infusions of ketamine. So that's my hypothesis, what's behind. Maybe I was somehow imprinted in 3 years just to have this pathway, but I'm not sure. This is just a speculation.
Well, my next question was going to be, when did you have your first psychedelic experience? Maybe you had it at the age of 3 and you didn't know?
Probably. Hard to say if this was psychedelic, because ketamine is kind of different. And of course, like a teenager, we had experiences with LSD and
so
mushrooms.
Uncontrolled, just like
uncontrolled, like most of the people. But honestly, to be said, the first real powerful experience I had in our institution as a healthy volunteer in a ketamine trial, and then we went. I think it was 2007 or something like that. We went to Chile, and we had an experience with San Pedro cacti, and it was in a very old ritual indigenous place up there in the Atacama Desert, and that was also very, very intense. And probably from there, and then there was another powerful experience as a healthy volunteer with psilocybin. But honestly, to be said, usually people in recreational setting, they don't use such high doses compared to what we use in our experiments. So the real full psychedelic experience, I think, for the first time, I definitely had in the lab.
You're the co-founder of the Psion Clinic here in Prague, which says that it's the first medical facility in Europe to offer psychedelics-assisted psychotherapy. What conditions are you mainly treating?
Well, actually, we focus mainly on ketamine because this is the only available medication which is approved. And the inclusion criteria mainly are for depression, but we also offer treatment for people with general anxiety disorder, with post-traumatic stress disorder, anxious depressive disorder, and eventually some others. We try to, or we dosed some patients that were with anorexia nervosa in order to see whether it helps or not, because there is some evidence, and some other rare conditions. Now, what is new, we are also having the license now to work with psilocybin and also with LSD. And we have 2 commercial trials coming on site. One which is from Compass Pathways, which is treating treatment-resistant depression with psilocybin. We have a site at Sion and also at National Institute of Mental Health. And the other one is with LSD in general anxiety disorder.
What kind of patients are most likely to benefit from these kind of approaches? People who have tried and failed, for example, psychotherapy or something like that?
Well, the concept of Sion is that we prefer to have people who are already in a therapeutic process, and the ketamine-assisted therapy is on top of that. So it's kind of a facilitating the therapeutic process. So it's kind of an accelerator of the process which is behind. And also the biological effect of ketamine might help improve the mood, quickly bring a quick relief from the suffering. This is how it is. What's the concept of the Sion? Of course, there are other ways. Not all patients require psychotherapy. Not all patients want the psychotherapy. So we also have the biological approaches, just like focusing only on the pharmaceutical effect of the drug or pharmacological effect of the drug.
How quickly can these alternative substances impact the patient or start working for the patient compared to normal antidepressants, for instance?
The experiences we have, they show that ketamine is quite efficacious. It can induce, in this context, quite long-lasting improvements. Of course, not in all subjects. And also from the data that we have from around the globe, it seems like it's with any other treatment. So it is about a third of patients that can have immediate relief and improvement, about a third that's so-so, and about a third that are non-responders. So this is kind of true for all treatments in psychiatry we have till now.
And if I understand it right, that from what you're saying, you're now bringing in the use of LSD, for instance. Is that the case?
It's not us. It's actually the MindMed company that runs the trial in Czech Republic also. We are one of the sites. And it's focusing on general anxiety disorder.
Why is it taking so long? Because I feel like every 5 years I see some headline, LSD could be used in psychiatric treatment. LSD could be a way forward for psychiatric patients. But it never really seems to go anywhere.
Well, in the real world, if you want to approve a medication to treat something, it needs to follow certain steps according to FDA or according to EMA, the legal authorities in US or Europe or others in other parts of the world. That means it has to go through phase 1, phase 2, and phase 3 studies. And today we are with some of the compounds like psilocybin or LSD in the phase 3 studies. Usually, or most of them, are sponsored by industry. So their intention is to approve this drug for treatment of specific diagnosis and to register it for this treatment. This happens with all compounds, and that needs time. There was this issue with MDMA-assisted therapy for PTSD that MAPS invested a lot into this, and actually FDA just put it off the table, and they have to do a new study just to convince the regulators that this is the adequate treatment. So this is how long it lasts. Honestly, if it's 10 years from phase 1 till registration, it's perfect. And we are currently in the phase 3 trials. They are started of different companies, and there are also some academic phase 3 trials that are currently ongoing. So it could be relatively short to get. So these companies would go for an approval, let's say in 2 or 3 years, and we'll see.
So yeah, how soon do you think this could be a real thing that people are benefiting from?
That's what I say. In 2 or 3 years, I would expect, if there will be positive outcomes of the trials, the industry will go for registration, and we'll see how the authorities will react. Could happen it will be approved. Could happen that the trials will not be as positive as they looked like, and could happen they will have some issues with how the studies were designed, and they will say, no, you need to do more studies. That's the uncertainty.
Are you also doing research into the use of cannabis? Because cannabis is not usually seen as a psychedelic drug.
We did some research with cannabis in the past, and there's so many things ongoing, so I'm not doing too much on it right now. We do have some preclinical studies with synthetic cannabinoids and with cannabidiol and its derivatives, not in the psychomimetic direction, but mainly we study the effects of cannabidiol and its analogs as a potential therapeutics in other cases. So that's where I am. I'm also counseling CB21 Pharma, which is a company that produces CBD. So yes, kind of interested in whether it could be used therapeutically. But as so much is happening in the psychedelic domain, I need to focus more on this topic.
Was it the case that LSD was tested in Czechoslovakia in the 1960s?
Yes, not only LSD, but also psilocybin. And it wasn't only tested, but it was used for treatment. And there were several departments where they used it extensively. Also in our, let's say, the National Institute of Mental Health was before Prague Psychiatric Center, and before it was Prague Research Psychiatric Institute, or something like that, translated to English. And that's where Stan Grof also worked, and others. So there's a kind of continuum of experimental use and therapeutic use of psychedelic substances in Czech Republic. And lots of patients were treated in Sazka by Dr. Hausner. And all diagnosis. There was lots of depression, anxiety, alcohol use disorder. At this time, there were not many other drugs or alcohol use disorders typically.
Why was that kind of research discontinued? Was it because Grof left for America?
No, it was because of the regulations. We continued, actually, the research continued a bit longer after 1971, but it was because of the international regulations that all these compounds were placed in scheduled drugs with no medical use. So they were banned, technically. So there was only limited medical use. That means for clinical trials and so on. That's where we are now. But the real therapeutic approach was destroyed.
I have a vague memory of reading an article that one of the guinea pigs in this testing in the 60s was Jan Schwankmayer, the artist.
I'm not sure if it was a guinea pig, but he definitely had the experience.
He was a soldier, I think, in those days, and he was one of the people who they tested it on.
Oh, could be, yeah. I don't know. There's actually a nice documentary, which is also available on YouTube, about how LSD was used experimentally in military troops of the Czech army. And there are videos available on the internet. It's quite funny to see them, how they react to how they're completely disorganized in the team. So, yeah. There were these military experiments also happening, but who went through them, I don't know. I know one police officer that collaborated with us who said, yes, I had it at this time. It was a very interesting experience.
Preparing for this interview, I came across a quote from you where you said, maybe if Putin took a good dose of LSD, he would change his attitudes and rethink how he behaves and what he does. This man is responsible for unspeakable atrocities and barbarism. Is it not naive to think that he could be somehow improved if he took acid?
Well, I'm kind of exaggerating because, we know psychedelic experience can change or alter psychedelic traits, but definitely cannot completely change the personality. And his personality is quite petrified. The hypothesis behind it is people who experience this profound experience and connectedness to universe and nature and other people probably we would expect that they wouldn't have accept this kind of behaviors that would lead to killing and mass murders and whatever. But Putin is a very special person, I believe. He has a very special training, and we don't know what the KGB agents go through when they are or when they were at the time, and also today when they are in their service. So we don't know what kind of experience he had, and maybe he had some kind of this experience in the past, I don't know, and it definitely wouldn't change his personality.
But essentially, as well as believing that psychedelics can be useful in psychiatric treatment, you also believe that everybody would benefit from taking psychedelics.
It's not definitely like everybody. There are people that might it might worsen their mental state. There are people who are, for now, completely contraindicated for psychedelics, even though indigenous people, they treat it differently. But let's say we have psychotic patients that have a clear contraindication now. And as I said, in patient population, 1/3 benefits completely, 1/3 so on, 1/3 it doesn't have anything. I feel technically anyone healthy can get some teaching and can learn from the experience, but the question how he will benefit and how he will integrate is unknown. So I think many people can have an important transformative experience if it's performed in a safe and good environment, but I wouldn't generalize it to everyone. It's always like kind of exaggeration a little bit.
My final question is, honestly, how optimistic are you that 20 years from today, the kind of drugs we're talking about will be regularly used in psychiatric treatment?
I hope it will be, if we find them to be efficacious, I hope it will be earlier. And it would be definitely, like ketamine is already getting a standard in psychiatric care. So I believe these compounds will also become this kind of standard treatment. But again, as with everything, not all people will benefit or not all patients will benefit. So we will have more information which diagnosis benefits. We will have more information how it should be combined with psychotherapy and what are the main benefits from combining with psychotherapy. There's this Swiss school of psycholytic therapy, and they use it like for continuously, even since 1971, and they use the psychedelic sessions or psycholytic sessions on top of continuous psychotherapy, and it seems to be really beneficial as well. So I think there's a lot to learn from this group of therapists, and we'll see how it will be implemented. But I'm quite optimistic. I think it will become a part of the regular psychiatric care in the future.
Many thanks indeed to Dr. Tomáš Páleníček for speaking to me in May 2025 for this edition of Prague Talk, a podcast from Radio Prague International. If you're a first-time listener and enjoyed this conversation with Tomáš, why not look up some of the many earlier episodes and subscribe wherever you get podcasts. But for me, Ian Willoughby, that's all for now. Thank you so much indeed for listening to Prague Talk, and talk to you again very soon.